Samost Jewish Family and Children's Service, in cooperation with Cooper University Hospital, present a family health podcast. In this program, what parents need to know about pediatric concussion, with Dr. Michael Goodman of the Cooper Health System. At the lectern is Jennifer Dubrow-Weiss, Executive Director of Samost Jewish Family and Children's Service, to introduce Dr. Goodman.
Good morning, everyone. Welcome to our very first Cooper University Hospital and Jewish Family and Children's Service of Southern New Jersey Family Seminar Series. It is my pleasure to welcome Dr. Michael Goodman here this morning. Dr. Goodman returns to Cooper following 15 years of clinical and administrative leadership roles and accomplishments in the tri-state area. Most recently, Dr. Goodman was Director of the Center for Children's Neurology in Voorhees, New Jersey, where he created the Concussion Diagnosis and Treatment Program. Prior to establishing his private practice, Dr. Goodman was an associate professor of pediatrics and neurology at Jefferson Medical College in Philadelphia. From 1996 to 2006, Dr. Goodman was on staff at the Alfred I. DuPont Hospital for Children in Wilmington, Delaware, where he was Chief Division of Neurology and Medical Director of New Jersey Clinical Operations. Prior to joining DuPont, he was on the faculty at Cooper University Hospital, Department of Pediatrics, Division of Neurology from 1993 to 1996, where he was also an assistant professor at Robert Wood Johnson Medical School. After completing his medical degree, Dr. Goodman served as chief resident during his residency in pediatrics at Overlook Hospital in Summit, New Jersey, and during his pediatric neurology residency at State University of New York Health Science Center at Brooklyn, he completed his fellowship in clinical neurophysiology at Thomas Jefferson University in Philadelphia. Board certified in pediatrics, child neurology, and clinical neurophysiology, Dr. Goodman also holds a master's degree in medical management from Carnegie Mellon University. Dr. Goodman is active in many professional societies and currently serves as the president of the Philadelphia Neurological Society and the Eastern Association, bear with me, of electroencephalographers. He has conducted numerous lectures and authored a variety of articles, abstracts, and book chapters. As a pediatric neurologist, Dr. Goodman has an interest in children with seizure disorders, fetal and neonatal neurology, and concussion. He is a certified impact consultant, which stands for Immediate Post-Concussion Assessment and Cognitive Testing. Dr. Goodman has a strong commitment to education and has been active in the education of medical students, residents, and fellows during his previous appointments. We look forward to Dr. Goodman's presentation, and thank you again for being here.
Thank you very much for that wonderful introduction. I'm not sure I recognize the guy in that introduction, but I guess it is me. So again, today we're going to talk about what every parent should know about concussion. We're going to hit some of the highlights of concussion. One of the reasons why this talk is important is as this famous Irish setter poster looks like, one concussion looks like another. So the Irish setter, when he's happy, when he's depressed, when he's angry or sad, looks exactly the same, and one concussion really essentially looks just like another. So we need to learn to recognize what's going on when the child looks as they do. Conflict of interest is an important part of any talk these days, and so I have no direct financial interest in any company. Nobody pays me to give any talks. I do use the impact test, which I'm going to reference during this talk in my practice, but I don't get paid by them. I make money with the talk. We charge for the test itself, but I don't get anything personally from it. And I do read some EEGs from an outside company. I want to acknowledge Mickey Collins, who is one of the co-directors of the concussion program at the University of Pittsburgh Medical Center, who developed this impact test program more than a decade ago, and I use some of his information in some of my slides. So what are we going to do today in the next hour? We're going to recognize the signs and symptoms of concussion. We're going to learn to understand the relationship of some of those comorbidities that associate with concussion and understand how to manage concussion and those comorbidities. Unfortunately, I got a few slides here that are YouTube links, but YouTube is blocked in certain locations when you give these talks in schools or other centers, so I can't give you the YouTube talks. If you want to look at any of these sites, you can do that certainly on your own. But picture says 1,000 words. I'm going to describe these pictures for you very briefly. The first one is one of the most famous concussions in the area is Eric Lindros skating across the blue line, getting knocked out by Scott Stevens. He seemed to do that repeatedly, Scott Stevens and Eric Lindros. And so it really got concussion known in this area in the Philadelphia region. And at that point, people really didn't appreciate what was going on with concussion, but it got me very interested. Second one is a skateboarder. A child on a skateboard who goes down a ramp, the handrail from a set of stairs, falls at the end of the stairs, hitting his head on the ground, goes unconscious, actually has a brief seizure. All the while his friends are filming him for YouTube because it's on YouTube, and nobody does anything. But the seizure stops and you get a concussion. Why is that important? You don't need to be an athlete in an organized sport to get a concussion. So any of our children that are out there on skateboards or bicycles are clearly at risk for concussions. Then there's a medley of soccer concussions from professionals, high schools, and college ranks that just shows people getting hit in the head, kicked in the face, kneed in the head, falling to the ground. Soccer is a really difficult sport, and a lot of concussions occur in that sport. Worldwide, probably the most common cause, not as high in the United States, more in football because more of our children participate in football, but clearly soccer is a big cause for concussions. Dancing is my favorite concussion montage up here. It's a group doing a little hip-hop dance and break dancing, and one of the dancers drops to the ground to do his move and doesn't drop efficiently. And when he hits the ground, he hits his head, and you see him stand up and stagger a little bit and doesn't get back into his moves appropriately. And here, just doing some recreational dancing, nothing sports about it, gets himself a concussion. Finally, the last two is a summary of some significant. The second impact syndrome is a child who was a captain of the football team, star football player, got hit. Nobody recognized the concussion. He was the quarterback, played the next week, got hit again, collapsed. And the next picture is this boy in the intensive care unit, intubated, ventilated, and then they cut by years later, and he just doesn't remember anything, and he's not the same person. Cognitively, emotionally, he's a very, very different person, and that sort of highlights this concept of second impact syndrome, which we'll talk about later on. And the last one is just a bunch of National Hockey League players that have ended their careers because of concussions. So, and you can get a concussion by getting jumped on by your dog. You can get your concussion by walking into a door. It happens every day. I see it in my office on a regular basis. So, what are we going to overview today? We're going to hit the definition of concussion. We'll look at some statistics, learn the mechanisms, look at the signs and symptoms, some of the comorbidities, things that happen in addition to concussion, how we manage it, and then return to play, getting people back to activities. And we'll try to get this done in about an hour, give or take. So one of the important things about playing sports is wearing the proper equipment. So this guy running around naked in the middle of the football field, that's not an appropriate way to play football. But clearly, helmet would be very helpful, but helmets do not protect you completely against concussion. Okay, so definition. Before 2001, there were dozens of concussion guidelines, concussion classifications, concussion protocols that were endorsed by multiple organizations, neurology, pediatrics, family practice. You name the doctor, you name the group, there are more than 20 different protocols and classification schemes out there. So in 2001, this group got together in Vienna, the first international symposium on sport in Vienna. Later, they turned this name into the Concussion and Sports Group. It just sounds a little bit better. But this group was composed of and sponsored by the International Soccer Federation, FIFA, International Ice Hockey, and the Olympic Committee. So it was really internationally focusing on what's going on with concussion. And they came up with a definition. Now this definition is 2 pages long. We're going to go through it a little bit. But just to put the picture of concussion, what it is, and you can read it, I'll read it to you, but just so you understand this, it's very complex. So concussion is a complex pathophysiologic process affecting the brain, induced by traumatic biochemical forces. Several common features incorporate clinical, pathological, and biochemical injury constructs that may be used in defining the nature of concussion head injury. Basically, you get hit in the head and you get problems in the brain. That's a concussion. Now, what happens here, basically, concussion is caused by a direct blow to the head or the face, or even a blow to the body that makes the head shake around, and you're transmitting forces up to the brain. Typically, it results in a short-lived, time-limited impairment of neurologic function that spontaneously resolves. Typically, it's associated with normal imaging, and we're going to repeat this later on in the talk. Normal imaging, the CAT scan test is normal. You may have some neuropathological findings in the brain tissue itself, and that corresponds with these acute clinical symptoms, and it's functional, not structural. Results in a graded set of clinical symptoms. You may or may not have loss of consciousness with a concussion, and the resolution of these symptoms are sequential. You can sort of predict how people get better. So this is really everything we're going to talk about on one slide, and now we're just going to expand this a little bit. So this is concussion. So this group got together again 3 years later, also in another beautiful European city in Prague this time, and they honed down their recommendations initially and broke it down to, you know what, let's just call concussion either simple or complex. And a simple concussion was described as the symptoms resolve spontaneous within 7 to 10 days. And you can manage this by anyone. You don't need to go to a specialist. A pediatrician can do it, a primary care physician, athletic trainers with medical supervision or experience can do this, and that's what concussion is, simple. A more complex concussion is one that's going to have persistent symptoms, or the symptoms come back. Or if you have specific neurologic sequelae when you get banged in the head. You get yourself a concussion, or you do lose consciousness for a period of time. Or if you have prolonged cognitive impairment after your concussion, we'll call this a complex concussion. Multiple concussions, we would call it complex. And in these people, we're going to look for formal neuropsychological testing because it's sort of hard to predict what's going on. Now, one of the things that we find and was described is that repeated concussions often take less impact to cause a second or a third or even a fourth concussion. With this group, they came up with more conservative return-to-play guidelines. They said that when you feel better, when the symptoms go away, you don't go back and participate in sports or full activities. We want you to become symptom-free at rest and then gradually increase your activities. We're going to limit your cognitive activity, limit physical and cognitive exertion, limit your activities of daily living. We don't want these people to jump into sports very quickly. And we can even limit their scholastic activities at this point. Now, this group got together a third time, called the Third International Symposium, this time in Zurich, and they said, you know what, let's forget about it. We're not going to call them simple, we're not going to call them complex concussions, we're just going to call them concussions and keep it all going at that. So right now, it's just a concussion. There's no grade 1 or grade 2 or grade 3, there's no simple or complex. You got banged in the noggin or you didn't get banged in the noggin. So it makes it easier. So let's look at some statistics, numbers, and data about concussions. Who's at the highest risk for concussion? Well, young children. The younger you are, the more likely. And again, there's more wiggle room for the brain. Younger children tend to be top-heavy. They fall and hit their heads more easily. So under 4 years of age is the highest risk group. But clearly, children and young adults from about 5 to 24 years of age. Why is that? They're doing all the activities that put you at risk. They're playing sports. They're riding bicycles. They're in motor vehicles with limited experience, okay? So they're putting themselves at risk for concussion and banging their heads. And also the elderly is at risk for the concussion, but I'm not going to really be addressing that. I'm a pediatric neurologist. How do you get a concussion? Name the way. You can fall, motor vehicle accidents, other kinds of unintended incidents, assaults, or sports injuries. And actually, sports injuries only accounts for a small percentage of concussions when you look at the global population. So memorize this list. No, don't memorize the list. This is a list of sports broken down into 3 different categories: contact sports, limited contact sports, and non-contact sports. We can look at it another way: high risk of concussion, moderate risk of concussion, and low risk of concussion. Now, the things you think about getting concussion on that high risk is basketball and football and ice hockey and lacrosse. But I want you to pay particular attention to the third sport on there, and it's cheerleading. One of the most brutal sports out there, and I've seen some of my worst concussions in cheerleaders, okay? So it is a high risk, high contact sport. Also, I want you to look down at the bottom, and you see things like swimming and tennis and track, and you think, how can you get a concussion swimming? Well, people bang their heads into the edge of the pool. There's relay races, and people jump into the pool too early and get kneed in the head. You can get a concussion doing anything, okay? But you just sort of have to maximize your risks or understand your risks in the world. So what are the numbers when we look at concussions? Put this into sort of an ascending order, and when you review the literature, this is how you really understand it, because there's lots of different numbers thrown around. And so this 300,000 number is more than 2 decades old, but it's a number that most people quote of concussions each year in the United States. But these are the number that are with loss of consciousness. And we know that less than 10% of people that get concussions lose consciousness. So 300,000 going to the ERs with loss of consciousness is a small number. So that second line talks about that 8 to 20% number of concussion. Most likely it's less than 10% if we look at overall. So the next line, that puts it at about 1.6 to 3.8 million sports concussions a year from traumatic brain injury. Most of these do not go to the emergency room because most of them didn't get knocked out. Okay, and that's a study from 2006. So number-wise also, about 1.5 million, 1.4 million traumatic brain injuries do get to the hospital or the emergency room. And when we notice that, about 75 to 90% are mild traumatic brain injury. Again, not losing consciousness, not having those severe problems. And that's how we see that 8 to 19% number of loss of consciousness. Most people that are seen don't have loss of consciousness, and therefore many people don't ever present to the doctor or the emergency room or their parents or coach. So we're estimating down at the bottom that 750,000 to more than 2 million go unidentified every year if we look at statistics. That's why I used to describe this in my talks. I've been giving these concussion talks for many years. I used to talk about this as an unrecognized epidemic. It's still an epidemic. It is now recognized, but it is global. More numbers. 10% of all contact sports athletes will sustain a concussion every year. Pretty scary. 63% of the concussions in the United States are from football. Why is that? The biggest organized high-risk sport in our country. About 20% of all high school football players are going to sustain a concussion every year. In a study, 47% of players reported at least one concussion during a season, and that was 9 times greater than what was reported to their trainers. So most of them do not tell their trainers or coaches that they got a concussion. And of that 47%, a third of them said that they had had multiple concussions during the year. Now there's a statistic that says once you've had a concussion, you're at 4 to 6 times greater risk to have future concussions. And why is that? Some people are more predisposed, but clearly the likelihood of future concussions is increased when you've had one at some point. And again here, 30% of all injuries in children involve sports. That means that 70% are not playing organized sports. Now, take-home messages about concussion early on. The effects of concussion are cumulative, and therefore no athlete should return to sports until they're completely recovered. The best way to prevent problems from concussions is to manage it effectively while they're having their symptoms. And I bolded this and highlighted it, and I'm going to repeat it several times during the talk. No athlete should return to play while they're experiencing the symptoms of a concussion. So this is really my summary slide at the beginning. We're going to hit it again at the end because these are very important points. What's the mechanism of concussion? Well, there's 2 basic mechanisms. We said you get hit in the noggin and your head moves back and forth either by force, blunt force, or by hitting the ground. And essentially the brain shakes back and forth inside the skull, just shaking up the nerve cells, the neurons, and all other structures inside the brain. I don't want to get too scientific there. Or your head can twist. And if your head twists while you're falling or getting hit, the brain twists on its axis, the brain stem, and causes other kinds of damage into parts of the nerve cells. To put one slide of science in here, because I'd like to throw science in, it's important, is that what you can see here is that there's changes in the way the brain cells handle potassium, sugar, glucose, glutamate, neurotransmitters, calcium, blood flow. It's all changed by sustaining a blow to the head. And those changes can last minutes, hours, and days. And that's why we watch these people can get better over this time frame. Done with the science. Okay, so what are the signs of concussion? So here's a long list. We'll read through a few of them. You can obviously read it yourself. But confusion, immediate or sometimes delayed by a few minutes. Memory problems, forgetfulness, inability to maintain a coherent stream of thought, inability to do goal-directed behaviors and movements, slowed movements, slurred speech, behavior or personality changes, disturbance of vigilance, loss of consciousness, disorientation, clumsiness, emotional problems, seizures, and amnesia. A long list. Basically, it's changes to the brain affecting your performance and behavior. I want to highlight amnesia because amnesia is both retrograde or anterograde. Retrograde is remembering things before the incident. Anterograde is remembering things after the incident. And what's important about amnesia is it is 10 times more predictive of concussion than loss of consciousness, because we've already said that most people don't lose consciousness. And so how do you know they had a concussion? Well, if you ask them, what happened? What were you doing? And they say, I don't remember. What's the last thing you remember? Coming to school in the morning. I mean, you don't remember being in gym class, getting kneed in the head? No. That's a good sign that somebody sustained a concussion. Or they're pulling your leg. Post-traumatic amnesia is a very, very predictive sign of having a significant concussion. So what are the reported symptoms of concussion? Again, a study that showed this. Again, this is from Mickey Collins' group out in Pittsburgh. This is high school and college athletes within 3 days of their injuries. They're reporting headaches, feeling slowed down, problems concentrating, dizziness, and fogginess. Fogginess is one of the best words up there because a lot of times you'll ask somebody how they feel, and they say, I don't know, I can't describe it. And sometimes they'll just say, I feel foggy. And it's like, bingo. That is used to describe concussion by a lot of people. Nothing scientific, nothing medical about that term, but it's reported. So fogginess is important. Fatigue and vision problems, light sensitivity and memory problems, and balance problems are very common. Again, all these more than 40% of the patients. Now, what does it feel to have a concussion? Anybody in this room have a concussion before? I did. Doesn't feel good. It's not a fun feeling. So that's what it feels like. And you can't put it into words, but it's like looking through foggy glass at a hockey game, and you don't get things into perspective, you can't really see things. That's what they feel like when they're feeling a concussion. Okay, now, you've gotten your concussion. What should make us worry? Well, these are the things that we should worry about when someone has a concussion. Within the first 24 to 48 hours, if these things happen, the patient should be evaluated immediately in the emergency department or by some sort of trained physician. So focal neurologic deficits, localized weakness, numbness or tingling or something like that. If they've had significant loss of consciousness, if they're, the one thing to remember here, what's written on about a lot of these areas is increasing problems. So increasing irritability, increasing confusion, increasing headache. And everybody remembers back to about 3 years ago, Natasha Richardson, you know, the actress that died from a concussion, the subdural, and the skiing accident. If anybody had watched her reporting increasing problems, that's the concussion patient, that's the head injury patient that needs to be evaluated, not staying home, not staying alone in your hotel room. Okay? So if the problems are increasing over 24 to 48 hours, get help. So again, we look in here, increasing behavioral problems, neck pain, seizures, drowsiness, numbness or weakness, slurring speech. If these problems are getting worse in the first 2 days, it's a bad sign. Now, we talked about these immediate symptoms of concussion. Sometimes they could present a little bit later, within days or weeks or months, and persist for a while. And so all those symptoms we talked about, headache, attention and concentration problems, focusing, their vision problems, intolerance to light or noise, frustration, mood changes, sleep changes. Again, we got that fogginess and drowsiness on there, memory problems. All those symptoms, they can persist for weeks as a normal sign of a concussion, of a typical concussion. Doesn't always get better. We'll talk about the statistics of how they recover right here. So these symptoms can last for minutes, hours, days, weeks, or even months. Some people don't recover completely. The typical person recovers completely within 3 days to 5 weeks with rest. And rest is important there. I'm not saying vegetative. You don't have to lay in bed for 3 weeks. But you don't want to be wrestling down the basement with your siblings when you're recovering from a concussion. You don't want the child to be kicking a soccer ball in the backyard. We don't want the child to go take the SATs when they're recovering from a concussion. Okay? So we want to rest a little bit during this time frame. So most patients are going to recover completely. And the statistic of most patients is about 85%. Now I'll give you a personal story. I like doing this a little bit. My son got a concussion years ago. He was in 6th grade. And back in those days, the typical person was supposed to recover within 3 weeks. That's the way the statistics were. That's what we were taught. And his symptoms persisted for 4 weeks. And as a neurologist, I was nervous and worried and got the CAT scans and the MRI and an EEG, and everything was normal. And at the end of 4 weeks, it was like a light switch went off. Headache got better, concentration got better, and he felt better. And a few years later, when the statistics and studies came out that said 85% recover in 5 weeks, it makes perfect sense. And I watched concussion patients every day, and so it is not unusual to take 2 or 3 or 4 or 5 weeks to recover from a concussion, personally and professionally. Now, if the symptoms last longer than 3 months, then we're talking about something called post-concussion syndrome. Now, I highlighted under here 3 weeks. Some people are trying to move this time frame earlier because, people should recover quicker. I'm a little bit against that, but it's what I just want to let you know how people are talking nowadays, particularly with athletes. They want them to get back into the sports, which we're going to talk about in the next few slides. But I don't think it should be that early because it does take a long time to recover. So, do athletes underreport their symptoms? Again, a study from the group out in Pittsburgh back from 2002. Here's using this impact test, and I'm not going to go through all major league science about this, but if we look in the blue column on the far left-hand side is people that were symptomatic. They said, I have a concussion. So their symptoms are bad. If we look on the far right side, we've got people that are controls. I did not have a concussion, never had a concussion. But the interesting group is the group in the middle. These are people that said that they had a concussion, but they felt fine. No more symptoms. Okay? And so if we look at the scores in verbal memory, the first column, visual memory, the second column, the people that say I feel fine look more like the people that say I've got a concussion than people that never did in both columns. And that's statistically significant. 2 other areas, the same testing. Again, the people with concussions and symptoms are on the far left. The people that are controls never had a concussion are on the far right. The people that say I feel fine but had a concussion are in the middle. And we look at processing speed, slowed. We looked at reaction time, increased. They're slow to recover, they're slow to react, they're abnormal, they're more like the people with concussion, even though they say I feel fine, which is why testing is important, because you can't just look at somebody and ask them a question. So, what is asymptomatic? Asymptomatic is not asking the child, how do you feel? Do you have a headache? Because you're going to get the same answer as, how was school today? Do you have any homework? Okay? Fine and no. Okay? So you have to ask specific questions when you're talking about concussion. So, do you have a pressure headache? Does pressure increase in your head as the school day goes along? Do you become dizzy when you stand up now? Okay? And we can read through this all, are you sensitive to light or noise more than usual? Are you feeling foggy during the day? Having trouble falling asleep or waking up? Okay? Have your parents noticed that you're more irritable? Do your friends notice you're more irritable? So by asking these questions and getting more specific answers, we can say, yes, you still have signs of concussion subjectively. But then there's tests that are available that can quantify that a little bit. So asymptomatic is not an easily defined term. It depends on what the questions you ask them. Okay, how long does it take for a person to recover from a concussion? Again, the same sports group out in Pittsburgh. So this sample, again, a decade old, but it's important. It was a groundbreaking research. They looked at 4,500 athletes in this sample. And of the 4,500, 410 sustained concussions during the school year. That's where that 10% number comes from. Pretty easy math. So what they did is they looked at these athletes, student athletes, within 2 days of their injury, and then again 5 days and 8 days later. It was broken up into high school, college, and professional athletes, males and females, and they were compared to some age-matched controls. So, again, to look through these slides, not to go in great detail, here we're looking at memory scores from this impact testing. The blue line on the top is control people, never had a concussion. The red line at the bottom are the concussion patients. So if we look at them at baseline, they look just like the controls. If we look at them 2 days, 5 days, and 8 days later, their memory scores are lower, problematic, from control. Same data, same test, looking at another score. This is looking at reaction time. Again, when you're slow, your reaction time goes up. Here's the same group. Baseline, they're the same. 2 days and 5 days, they're slower. By the time we get to 8 days, the reaction time is back to the control group. So again, these are people that said I had concussions, but I feel okay. So how do we manage people with concussion? They're going to tell us they feel fine. So what we've got to do is acute management is going to evaluate them. Make sure that something bad didn't happen to them when they got their concussion. When they're laying on the court, when they're laying on the sidewalk, when they're laying in the gym, in the football field. So make sure something more serious didn't happen. Do a quick neurologic examination. Are they awake, breathing, no fractures, no neck injury, no other kinds of problems? And if there's a concern, we can image them, CAT scans or MRIs. And the key thing that I find, and studies have shown, is by educating people as to how they're going to recover from concussion, allows them to recover better. Why is that? Well, if you're sustained a concussion and your headache lasts for a week, and you're sitting at home concerned, thinking that you should have been better in 2 days, because that's what some people told you, then you get nervous and worried and really afraid. And your parents do too. And your teachers do, and everybody gets worried about you, and it just sort of escalates the symptoms. And so if you explain that you're going to get better statistically, 85%, within a few weeks, let's watch this get better, you're not going to feel better in 24 hours most likely. Give them the education. A lot of patients feel much better understanding their natural course. So that's important in the acute management. And that's probably what I do most of the time. Post-injury management, what are we going to do after they've had their concussion? Well, we're going to try to prevent second impact syndrome, which I've highlighted a little bit, we're going to talk about later on. We're going to try to prevent the cumulative effects of behavioral and thinking problems from repeated concussions. And we're going to try to prevent this post-concussion syndrome by not letting them get their coconuts banged again. So, again, we talked about determination of asymptomatic is essential to let them go back to activities. We don't want people to go back while they're still having symptoms. History taking, when we examine somebody who has had a concussion, what's important to me as a neurologist and to a concussion expert? Well, have they had previous concussions? Has the person had previous loss of consciousness with concussions? Or amnesia with their concussions? Post-concussion syndrome, did they get their concussion and they've never recovered? These are all important things. Did they have amnesia at that time, and how long did all these symptoms last? Helps us understand what's going to predict what's happening with this current concussion. Have they had past trauma to the head, face, and neck that nobody ever diagnosed as a concussion? And a lot of people have had that, unrecognized concussions. Do the symptoms get worse every time they've gotten subsequent concussions? Again, likely, but we have to ask about that. Helps us predict what's happening currently. And can we get some description about the injury? Where were they hit in the head? What kind of symptoms did they have? Is sometimes helpful in understanding. Also, pre-morbid conditions. A patient with headaches before concussions are more likely to have concussion, first of all, but are more likely to have a long recovery phase. Attention problems, learning problems, and behavior problems are associated with more protracted recovery phases. So it's important for us to understand that before we make predictions. Imaging studies. Everybody gets a concussion and everybody wants to get imaged. But we've already told you that group almost a decade ago said it's probably not necessary. So, not helpful in the majority of concussions, CAT scans or MRIs. Why is it? Because it's insensitive to the subtle functional disturbances. These are structural tests. They're not looking at function of the brain. Okay? They don't look at physiology and pathology that way. Now, you can do a CAT scan to make sure that somebody hasn't had bleeding in their brain with a significant injury, hit in the head with a baseball bat without a hat, without a helmet. That's likely to cause bleeding under there. A car accident, more likely to cause bleeding, okay? But getting hit with a football helmet, the likelihood of having a subdural is very, very small. Functional imaging. Everybody likes to talk about this. Functional MRIs and PET scans and other kinds of fancy computer tests. First of all, to do this, the functional imaging, you do some specific cognitive testing and then have the patient have an MRI while it's being done. And you look at alterations of patterns of normal activation in the brain while you're imaging the person. The problem is it correlates with brain metabolism. It correlates nicely with areas that are not functioning properly, but we really don't have controls in this. We don't use it typically in standard clinical care. It's being done in research. Maybe someday it'll be more effective, but we do not do this kind of testing routinely for the average concussion patient. So, all the conferences state that conventional structural imaging is usually normal and holds very little value in a typical concussion patient. We'll perform neuroimaging studies when there's suspicion or concern of loss of consciousness, other neurologic findings, or progressive symptoms. Okay? Those are the people that need to be imaged. An MRI, there's fancy techniques that can be done that's a little bit more subtle with just a standard MRI. We don't need to go to the functional MRI. Now, we talked about predicting the future. So what are some risk factors for a protracted recovery from concussion? Well, history of prior concussion, we already said that, 4 to 6 times increase if you've had one to get a future one. History of headache, particularly migraine headaches, either personal or a family history of migraine. And there's some people that are looking at the possibility of a spectrum of disease, including concussion and migraine, because a lot of the symptoms, anybody that has migraines that was reading the list of symptoms for concussion, a lot of that is very similar, okay? So migraine is a risk factor for protracted recovery. Developmental problems, attention deficit problems, learning disabilities, developmental delay, makes it more likely to have a longer recovery. Psychiatric problems, anxiety, depression, mood disorders, sleep disorders. And one area that studies find that I sort of chuckle at is pending litigation is a bad prognostic factor for a prolonged recovery. So not really medical, but it's predictive. So I'm going to talk about some bad consequences of concussion that are scary to parents and because it's there, but these are unlikely to happen, but it's what everybody's worried about. So we're going to look at epilepsy, headache, behavior problems, and cognitive difficulties. There are other neurologic consequences that are very rare and really reserved to the more severe head injuries, hematomas or blood clots in the brain, hydrocephalus or the fluid structures swelling up in the brain, and motor problems and spasticity problems. Again, very, very unlikely to happen with a typical concussion. So let's look at epilepsy a little bit. There's 2 major kinds of epilepsy or seizures that happen after concussion, and one is called early post-traumatic epilepsy and one is called late post-traumatic epilepsy. Simply stated, early is a seizure occurring within the first week, late is happening after a week. There's also something called an impact seizure, which happens immediately after you hit your head. This is something that typically happens to neurologist children because it gets us nervous and worried, but it's not something that is worrisome for long-term epilepsy. So you bang, hit your head, brief seizure, usually nothing to worry about. But something that happens within that first week is an early post-traumatic seizure, and we see this in about 5% of the children that are hospitalized. Now, again, hospitalized, these are the ones that had the more significant injury, possible loss of consciousness, concern of loss of consciousness, not the typical child on the sports playing field. Happens more likely under 5 years of age, so younger children are more risk for that. It's often what's called a partial seizure or a localized seizure, and we treat these patients with phenytoin as a preventative agent during that week. It doesn't prevent long-term seizures, but it can help stop those seizures in the first week. When we go to late post-traumatic seizures, again, about the 5% number. It typically is going to happen within the first year of getting your closed head injury. And the risk factors for more prolonged for these late post-traumatic seizures are, again, what you'd think for a bad concussion. Amnesia, bleeding in your brain, skull fractures, early post-traumatic seizures, and bruises in the brain itself. So again, bad concussion, more likely to get it. Mild concussion, not likely to get it. But again, we don't use those terms bad and mild anymore, but you know what I mean. Headache. This can be delayed for up to a few weeks, 3 weeks after the closed head injury. Acute post-traumatic headaches are typically self-limited. Again, we talked about that as one of the major features of concussion, so it's typically going to go away within 3 days to 5 weeks. It can be treated symptomatically with Tylenol, acetaminophen, or non-steroidal anti-inflammatories, Motrin, ibuprofen, those kinds of drugs. But I try to stay away from those medications because we know that the headache is going to get better. And these medicines aren't really that helpful. So if it's going to get better and it's not really helpful, don't take it. And so I try to get my patients not to take a lot of these medications. If it's really bad, sure, you can take a Tylenol once in a while. Acute or chronic post-traumatic migraines, again, after somebody has had a concussion, you can get migraine headaches, which are episodic headaches. And we treat them the same way we treat other migraine patients, although one treatment in particular is amitriptyline, is used more likely for what's called post-traumatic migraine headache. Now, post-traumatic migraine, episodic headache, once a week, twice a week, 3 times a month, is different than a continuous headache of post-concussion syndrome that doesn't go away. Okay? A little bit different, continuous versus an episodic nature. We'll talk about that under post-concussion. Behavior problems. So there's an increased risk of mild traumatic brain injury in people with premorbid behavior problems. Okay? So if you've got ADD or other kinds of behaviors, you're more likely to jump in front of a car, do something impulsive, get hit in the head. Okay? But at the same time, it can be a consequence of the traumatic brain injury itself. So this is potentially debilitating. And people that have concentration problems and behavior problems after traumatic brain injury sometimes really have significant struggles. More likely, the younger you are. And again, we can't quantify this. It's really hard to look at the percentages of risk, but it truly does exist. Although I must tell you that I had 2 patients early in my career that had ADHD, had a closed head injury, and got better. I don't recommend closed head injury as a treatment for ADHD, but I'm just letting you know that it worked in those 2 children. Other specific behavior problems, you can get anxiety disorders, depression, panic attacks and phobias after getting hit in the head. How do you manage it? Same way you would manage it if it wasn't from trauma. Psychology with behavior therapies and family therapies and other kinds of psychotherapy. Psychiatry, the medical doctor end of psychiatric care, with psychotherapy and medication management, and it's just, you deal with the consequences that's there. Learning difficulties, again, another potentially debilitating consequence of closed head injury, most likely in younger children, very difficult to quantify. How do we manage it? Well, first you got to test it. So these are children that need formal neuropsychological testing, child study team testing, school testing to see if they're struggling and where they're struggling. When these children are going to recover, it typically occurs within the first year. After the year, they're unlikely to recover significantly after that, and it's, again, potentially debilitating. What kinds of learning problems do we see in children after concussion? Well, visual problems, visual closure, visual spatial problems, attention, memory, intelligence, new problem solving, you name it, lots of different areas. They can have difficulties with learning. Now, we're going to hit on the post-concussion syndrome. I've described it 3 or 4 times, and here's the list. Basically, it's the same symptoms from concussion that don't get better. So it's a concussion that lasts for more than 3 months. So the headache problems, the attention problems, temper, mood problems, sleeping problems, balance problems, anxieties, all those symptoms, okay? So how do you prevent it, or how do we sort of work with this? Well, people returning to sports too soon often don't let the symptoms recover, and therefore the symptoms can persist longer. So we want to make sure that the people don't return to activities, full activities, before they're ready. So again, we talked about greater than 3 months of symptoms as post-concussion syndrome, and this is where we often start talking about psychology, we often start talking about psychiatry management, learning assessments, therapy, visual therapies, balance therapies, because there's a lot of difficulties that can make this a quite difficult problem. Non-physiologic factors, again, likely to have post-concussion syndrome are premorbid behavior problems. Again, we talked about the prolonged likelihood of protracted recovery. So lower socioeconomic status, not able to get the care and the treatment that's necessary to help manage them appropriately, lower educational levels, poor family dynamics, and again, there's that medico-legal problems are more likely associated with concussion, with post-concussion syndrome. How do we manage it? Well, we try to normalize activity at the same time as calming stuff down. So we don't like to have the people homeschooled if we don't need to, these children. Sometimes we need to. But you want to get them back on the saddle, get them doing things. Not contact sports, not high exertion, but just walking and moving and trying to get life going. Gradually increasing this, partial return to school if they, when they're able to, and then clearly the therapy support of this, vestibular therapies, balance therapies, and behavioral therapy is very important for post-concussion syndrome. Again, a video that doesn't work, but again, the picture, you can just sort of see this. This is not the same guy in my first video, but he says, I'm Brandon Schultz anymore. I'm not Brandon Schultz anymore, you know. Now, I am Brandon Schultz, the same guy, but different. It's very, very difficult at times. And this is what post-concussion syndrome is. They know that they're not functioning where they were. The children have difficulties focusing, difficulties remembering, cognitive difficulties, and this is what it can be in the long term. This is often related to this concept of second impact syndrome. Now, in the strictest definition, second impact syndrome is a result from a second concussion before the first concussion is healed. And again, most likely to happen under 21 years of age. And what happens here is you have a loss of autoregulation and brain function, so the brain can swell and cause herniation and death. Now, there have been very few described cases of true second impact syndrome, herniation, death with a second concussion. I like to think about second impact syndrome as truly that second concussion causing more symptoms, lasting longer, but not necessarily making you die. Everything in life has a spectrum. So clearly death is the worst outcome from second impact syndrome and can happen, but just prolonged recovery, longer symptoms and worse symptoms is more likely to be the consequence of that second concussion before the first one is healed, which is why we don't want people to go back to sports before they're healed. There's a new entity that's being described called chronic traumatic encephalopathy. This is from multiple concussions, and it presents with, manifests as, chronic headaches, mood problems, and depression. And what we see in these patients are findings on autopsy in the brain, usually done after they die. This is really, really severe, but the National Football League is right now doing a study, and people have probably read about this, that they're donating their brains, some of these athletes, to this group up in Boston to study what's happening in the brains after death. Somebody very near and dear to us in this region, Andre Waters, a couple years ago, suicide, football player who just helmeted everybody every game, every week. I'm sure he did it in practice. He probably did it at home. This guy just tackled with his head all the time. And so he died with depression and suicide. This is what we're looking at as chronic traumatic encephalopathy. I'll tell you an interesting story. I did a program several years ago with Keith Primo. Everybody remember Keith Primo? You know why he retired? Concussions. Come on, there's a theme here. Okay. Now, he told me that it took him 18 months after he retired to finally realize what it was like not to wake up in the morning and feel like he had a concussion. Okay? That's bad. He wasn't diagnosed with dozens of concussions. He had multiple, but from the blows of chronic, sports at a high level, it took him a long time to finally feel normal. All right, 18 months of rest. So it can happen. I haven't spoken to him lately, but he seems like a pretty normal guy. So let's look at wrap up some concussion keys. We've got a few minutes of summaries. I got summary upon summary, but the concussion keys. I've said this before. I want to highlight it. It's the most important aspect, that no athlete should return to play with the symptoms of a concussion. All athletes should be evaluated. Okay, we know that football has the highest risk, but we know that other sports like soccer and wrestling and cheerleading and even things like baseball, basketball, and swimming can have concussion. The impact test is a test that's available to test and quantify people's recovery from concussion. And the bottom line here, again, bolded and highlighted, proper management of concussion is the best form of prevention for future concussions, okay? You don't let somebody get a second one while that first one is still healing. So how do we manage it? All literature and data supports that any signs or symptoms of concussion, no return to play. When somebody is immediately after a concussion, don't want to leave them alone. We talked about that earlier. Increasing signs and symptoms in the first 24 to 48 hours are bad. If someone's alone during that time, we can't tell. So don't leave people alone early on. Watch them to make sure they're not deteriorating. Once they become symptom-free, we try to look at more formal neuropsychological testing now with that test like the impact test. And again, there's other tests that are out on the market besides the impact test. Impact is the one that I'm most familiar with. And then at the bottom, the return to play is in a stepwise process. You don't feel better on Tuesday and Wednesday go play a football game. You feel better, and we're going to gradually get you back to activities. Okay, so here's how we do that. Become asymptomatic at rest. Become asymptomatic on testing. Then we get some aerobic exercise, walking, stationary biking, things like that, light weightlifting. We then can go to a little bit higher activity, jogging, more sports-specific training, running. Then we can kick it up to non-contact drills, full contact training, and then back to sports activities. Now this focus on sports is more for organized sports athletes, the typical backyard warrior. I sort of summarize those bottom two, usually put them together a little bit. If you become symptomatic while we're increasing your activities, you got to return back to rest and then go back down the list again and gradually increase your activities. You got to become asymptomatic at rest again. Now, there's no book that says how you keep people out of sports and how we do this gradual increase, but this is my cookbook to management of concussion. So if somebody has transient symptoms, again, the old-fashioned mild concussion that we would have called mild, again, the symptoms are mild and go on very quickly. I increase their activity every 2 or 3 days, from that mild exertion to moderate exertion to heavy exertion and sports stuff like that, every 2 or 3 days. So it usually takes about 1 to 2 weeks to get back to activities. If they've had more prolonged symptoms, but not a big concussion, I do that every week. I increase their activities. On the other hand, if it's a more significant concussion, again, using that old thought of complex concussion, but more significant, but the symptoms go away transiently, I do that increase every 3 to 7 days, depending on how they're recovering. And if it's a more significant concussion with more prolonged symptoms, I do this gradual increase of activity every 2 weeks. It's my recipe. It works pretty well with my patients that I follow. The key thing is you got to be available to watch the patients, watch people recover, and know that if you get symptoms while we're increasing, you got to back up to rest again. So in summary, don't get that happy, I got a few summary slides. Concussion is a traumatically induced alteration in mental status, brain function, with or without loss of consciousness. The symptoms are quite varied. There are comorbidities that can affect the recovery, and those comorbidities include headache prior, attention problems or learning problems or behavior problems before. The second impact syndrome is something we see by getting a second concussion before the first concussion is healed. Post-concussion syndrome is prolonged symptoms more than 3 months after the concussion happened. And once you're symptom-free at rest, we're going to gradually increase your activities to get you back into play. Watch for those symptoms as you're increasing it. And again, we may need to have school activities curtailed, cognitive activities such as SATs and PSATs. We give people less homework, open book tests, more time to take their tests when they're recovering from concussion when they need it. Concussions are one of the most serious medical problems at the high school sports level right now. Proper management is the best way to prevent serious injury. Lots of people, schools, therapists are being sued because they're not managing it properly. You got to understand, you don't send people back on the field. And again, people, you want to make sure you manage the concussion properly. Impact testing and other cognitive testing is appreciated by the parents and by the students themselves to let them know how significantly they're affected. And it's nice to see in black and white a number that says, yes, you're struggling. I can tell you many, many times a student will come in and say, I feel perfectly fine. I have no symptoms at all. They take the test and their scores are very bad. And they say, yeah, you're right. I don't feel very good. I sort of said I was feeling good because I wanted to get back and play. So the testing is very helpful. Prevention. Well, protective equipment is helpful, but it cannot prevent injury. Okay, it cannot prevent concussions. The best example of this is helmets are very, very important on bicycles. Children in bicycle accidents in the decades before we wore helmets were getting skull fractures and really, really bad injuries. We don't see those injuries as much anymore because they're protected with the helmet. But when we talk about the mechanism of concussion, children that are wearing helmets still fall to the ground, still bang their head, and still have that bounce of the brain inside the skull. So it doesn't protect against a concussion. You can't. There's studies that are looking at all these fancy new helmets in football. Again, if you're going to get blindsided and hit your head to the ground, your brain is going to shake back and forth. You cannot prevent concussions, but you can manage them properly. So education. Every blow to the head is a potential concussion. Athletes need to know that. Trainers and coaches need to know that. Parents need to know that. Another quick story, early in my, several years ago, one little guy that I was taking care of a concussion was an ice hockey player. And I told him about this, and when he came back for follow-up, he told me that during one of their subsequent games, one of his friends got hit in the head and fell to the ground. And he told the guy, you got to get off the ice. You can't continue to practice. You've got a concussion. And the coach said, no, you can go back on. And the kid said, no. My doctor said that could be a concussion, and he shouldn't go back on the ice. And this little mighty hockey player was right, and the coach was not right. Okay? You don't want to give that risk. Don't get right back on the ice, or right back in the cheerleading training session. I've had cheerleaders get 8 concussions sequentially because they're trying to do that move, that flying move where you get caught and your friend doesn't catch you, and you do it again, and she doesn't catch you the second time, and they do it again. And I've had a girl that had 8 concussions in a matter of half an hour, witnessed by her mother, who was her cheerleading coach. Okay? But that's cheerleading. It's a sport. They're dedicated. They're making sure that they're getting the moves right. But she had a bad concussion. Communication. Let people know when you suspect that a concussion happened. If you're a parent on the sideline and you see it, and the other parent comes in later on and says, your child got hit in the head, may have been a concussion. It's not worth the risk of playing with a concussion. Athletics is for fun. We all look at our children as our lottery ticket. The next Shaquille O'Neal, the next Derek Jeter, the next whoever the next one is going to be coming down the line. The likelihood of the average child playing sports down on the street, playing mighty mites, playing high school football, becoming a professional athlete with those multi-million-dollar contracts is like getting hit by lightning twice. Doesn't happen. Don't plan on it. It's not worth the risk of repeated concussions. I'll tell you another angle to that. We talked about people being more predisposed to concussions, some more than others. Professional sports is sort of a selective process. If you keep getting tackled and banged in the head or kicked in the head and getting concussions, you stop. If you keep tackling and getting hit in the head and don't get concussions, you keep going. As an analogy to that, what's the object of boxing? Give the person a concussion. They don't say it that way, but it's a knockout is a concussion. And so a good boxer is somebody that can get hit in the head and not sustain a concussion. A bad boxer is somebody that gets hit in the head and gets a concussion. Bad boxers stop. When you watch boxing on television, most of those guys have records that are 23-0, 42-1. You never see somebody who's 5-10, okay, because they've stopped. They can't keep doing this, okay? That's just concussion numbers in black and white. So athletics are for fun for most of us. In conclusion, concussions are underreported. Education of the public, the players, the coaches is important. On-field assessment, serial assessments afterwards to make sure that somebody is getting better and not getting worse. Sometimes neuropsychological testing is helpful to get people back into activity and to watch them recover. There's a multidisciplinary approach, sometimes using counselors and psychologists and therapists. And then there's continued research in the field of concussion as we sit. When in doubt, sit them out. There's a friend of mine's slide, and it makes perfect sense, and it's a great way to end things. So with that, I'll take any questions if you have any.
In the situation where you're in the 15% bracket, where you're not recovering within the 5-week period, and an adolescent, teenager football player has an injury and has mood swings and has depression, what's the long-term prognosis for a situation?
Again, as I said, the majority of these people are going to recover completely.
So let's assume it's lasting beyond a year.
Right. Well, if it's lasting beyond a year, then it's likely that this is going to be, first of all, from 5 weeks to 3 months becomes that just prolonged concussion. Because some people, there's a small percentage, it's a line that comes up like that. It approaches 100%, but nothing is ever 100% in medicine. So after 3 months, it becomes post-concussion syndrome. After a year, it's still post-concussion syndrome and very likely to have complete recovery at that point. Now, therapy, management, and other behavioral therapy, vestibular therapy, balance therapy, eye therapy. There's a lot of ways that we can help support these children. School assessments, adjustments in their school program, their academic program. There's a lot of ways to help someone with chronic concussion symptoms function. But they don't always get back to where they were. And again, that's that Brandon picture up there.
Right.
Not always as severe as that, but there are clearly sometimes long-term consequences to it.
Thank you.
I have a couple of questions. The first one is, I have a child that's sustained 2 concussions, one in field hockey and one later on when she was helping someone at the gym. Theoretically, she completely recovered from the first one, but it looks like it may have overlapped a little bit. And with the second one, the headaches are continuing. So what do you think of alternative forms of, massage or different kinds of, there's a whole list when you start looking at alternative forms. Some ways to relieve that dull headache that's there every day.
It's a great question, and clearly there are many alternative forms of treatment. The concept of integrative medicine is out now. Massage therapy, meditation, yoga, relaxation techniques, psychotherapy, it's all possible. Another area to consider, and again, when some people have persistent symptoms, is this a post-concussion syndrome? Is this a post-traumatic mood disorder? And I can tell you that I've treated patients that were star athletes. One in particular was a star football player. Symptoms were bad, couldn't play football anymore, and captain of the football team, it's tough. It just didn't make sense. It seemed to me that he was struggling for a little bit longer than I expected. Suggested it may have been some sort of post-traumatic mood issue or depression. Saw a psychiatrist, was put on a medication to manage depression, and within 2 weeks he was a different person, back to his old self. Now that's a miraculous story, and it doesn't always happen that way, but that highlights the concept of a post-traumatic mood issue. And if you're having depressive symptoms or other mood problems, headache is part of that process too. Where do you draw the line between headache and depression, depression and headache?
Okay, I don't think that, well, from a mother's standpoint, I don't think that's the issue yet.
Correct.
But
it's another direction.
It's very trying for her to wake up with these headaches. And then as she gets involved in things, she forgets about them, but they're there. It's like, this headache is there, so.
And that's where distraction techniques and psychotherapy and other kinds of mood approaches may be to just help calm her down and get her distracted. And if she can learn distraction techniques, the headaches may go away. Sometimes medications are necessary.
You're also suggesting that Tylenol, Advil, that you want as much as you can to stay away from those?
She should not be.
Pretty much, she is very open to that and has basically done it. It's just
Tylenol, Advil.
We're at like 4 weeks, so we haven't hit that 5-week mark.
Right. Chronic use of those over-the-counter analgesic medications can cause something that's called a rebound headache or persistent headache or medication overuse headache syndrome. And so you don't want to use pain medications, over-the-counter pain medications, or other kinds of prescription pain medications more than a few weeks. If it's continuing, particularly for neurologic issues, headaches and trauma, you don't want to do that.
Now, you put the magic thing as 5 weeks, but yet you start post-concussive symptoms at 3 months.
Correct.
So what do you put between, what's the label between 5 weeks and
Again, I
3
said,
months?
if we look at statistics and averages, and again, one of the reasons statistics are very difficult is you can find a paper, an article, a research study, or a book chapter that has varying numbers. You could get 10 papers that have 10 different statistics. So the number that I like to use, because it seems to, number one, make sense from the literature, and more importantly, me as a clinician, makes sense from patients that I evaluate, is that 5 weeks is where the typical person will recover by. So, meaning that most, pick a number, 85%, will get better within 5 weeks. That still means that that 15%, it's still normal for them to have symptoms at 6 weeks or 8 weeks or 10 weeks. Once we get to that 12-week number, we call it post-concussion syndrome. Now, one of the difficulties of this is it's not rocket science, it's neurology. And we don't, it's not black and white to say 5 weeks yes, 6 weeks no, 12 weeks yes. It's not like that. And every patient's a little bit different. So in my practice, 5 weeks is what I use for typical, but I tell people that some children, some patients recover within 2 or 3 months. And so therefore it's not unusual. As long as the patient is getting better during that time frame, continuing to show some signs of improvement. Okay?
And what are your recommendations as far as academic, the academic part of it?
Well,
I mean, her teachers have been wonderful, truly wonderful, and we're getting back into it, but I was just curious.
schools are getting better at recognizing the management of concussion. What we try to do is to reduce the workload while someone is recovering from a concussion, particularly during the acute phase, that first month or two. So we recommend sometimes less schoolwork, less homework, open book tests, longer time to take their tests, breaks during the school day, sometimes a chance to rest during the school day, put their head down, go to the nurse's office or something for a period of time. We'll often sometimes recommend partial school days, only come in the morning, go home. So it really has to be individualized for the patient.
Thank you very much.
You're welcome.
After a child's had multiple concussions, does that leave a scarring on the brain that could be picked up like in an MRI in case something else happens later on in life?
Typically not scarring on the brain. There's
no indication that there has been a concussion.
Correct. The typical concussion leaves no structural markers behind. There sometimes can be functional problems that can be found on special research-based, what's called functional MRI and PET scan testing, but that's not used in clinical care. So the typical person that has had a concussion or multiple concussions has a normal MRI.
Okay, thank you.
You're welcome.
How do you differentiate between the scientific dinger where the kid gets hit, falls down, the coach usually puts up 3 fingers and says, "How many do you see?" And he says, 3, and he says, "You're looking good, back into the game," between that and a concussion?
Well, what you did, hopefully you weren't trying to fool me, because you said 3 fingers and you put up 2. So I only saw 2 when you said 3, but that's a different story. The bell ringer is a great research paper that was actually put up by the group from Pittsburgh. And we looked at the bell ringer, and they had patients that had their bell rung. Anybody knows the bell ringer is getting your head dinged, you feel woozy, and within 5 minutes you're back to normal, everything's fine, and life is good, coach. So they looked at these patients and had bell ringers symptom-free within 5 minutes, and then other people that became symptom-free within 15 minutes. And both of those groups, even though they said they were symptom-free, when they were tested 2 days later and 4 days later, still had signs of concussion. So again, it goes back to the not a mild concussion, not a complex concussion, not a grade 1 or a grade 3. You got dinged in the head, you got a concussion. And you should be out for that contest. They should not get sent back into the field of play.
Thank you.
Hello. I have a son. I have a son who's 17 months old, and 2 weeks ago he fell out of his crib while my mother-in-law was supposedly watching him. What should I be looking for in him? I mean, he started crying right away. He didn't lose consciousness or anything like that. We checked his skull. Didn't look like there's any bumps on it. But what should we be looking?
First of all, it's always the mother-in-law. Okay, so I know that. I can say that very clearly. It's always the mother-in-law. Or the father, because he's not here either right now, so you can blame it on him too.
Yeah,
but that's
watching
okay.
him.
So that's the history that I get all the time in the office. The symptoms are the same. So we talked about confusion, sleep changes, mood changes, headache. So what you're going to want to watch in a 17-month-old, you can't ask them if they have a headache. You can't ask them if they feel confused. But you can observe them and watch them. Are they going about their activities at the same rate, the same passion, the same interest that they had before? So if they're playing with their toys and running around and doing the things they normally do, it's perfectly fine. The flip side of that is if we decide that this child has had a concussion, I've made these diagnoses in younger children at times, and it becomes really problematic when we say, just have them rest for the next week or two. And unless you've got Velcro diapers, you can just put them down on the floor, there's no way that a child is going to become able to rest. So what you want to do is really try to just keep the child as calm as possible. You wouldn't take them to a birthday party the week after that happened. You wouldn't take them to the amusement parks and go on the rides or something like that. If you were going to the beach and going on the waves and jumping around, you would try to just keep things more subdued for a period of time and just watch the child, making sure they're back to where they're supposed to be.
Thank you.
You're welcome. Good question. Thank you. Any other questions? Thank you very much. It's a pleasure.
We hope you enjoyed this program from the Samost Jewish Family and Children's Service of Southern New Jersey. For more information, visit jfcssnj.org. We produce these programs in the studios of Professional Podcasts in Cherry Hill, New Jersey, on the web at professionalpodcasts.com. For everyone at JFCS, this is Steve Lubetkin. Thank you for joining us, and take good care.